you and yours are staying healthy and safe wherever you may be. As part of my Careers During COVID series, I'm excited today to talk about a topic that is top of mind for many members of our community: virtual consulting. Many international development and global health experts work as consultants, which entails a lot of international travel, always being on the hunt for the next assignment. And given the current climate, it has left a lot of experts wondering how they can continue to provide their services with travel bans and so much uncertainty. So I'm delighted today to be joined by Dr. Elvira Beracochea, who is the CEO of Realizing Global Health. She is a medical doctor, MPH, global health expert extraordinaire with lots of experience around the world in health system strengthening, project management, and monitoring evaluation. She really is a fountain of wisdom when it comes to building a career in global health, and someone we've been happy to collaborate with in the past. And she recently wrote a LinkedIn post on how to succeed as a virtual global health consultant that had all kinds of great tips and advice. So I thought, who better than to join us today to talk about how individuals and organizations can continue to do their important work, but virtually. So Elvira, thank you so much for joining us today.
Oh, you're welcome. I'm delighted to be here. Wonderful.
Virtually. Well, yeah, thank you. And in your post, you talk about there being kind of 3 different kinds of global health consultants. Can you walk me through those 3 different types?
Yes, in global health, the same as when you work as a consultant and the same as you work virtually, you see people that have a master's degree in public health and those that are working in the health system. So you have those that work in the healthcare delivery part and those that work in the programs part. So you have people, for instance, that are doctors and nurses and surgeons and work in the health system delivering healthcare, and those that work in prevention and disease control programs, those that manage that part of the public health system. So you have public health and health system people. And like me, that people that have an MD and those that also have an MPH. So we can work in both worlds. And I can help in improving the healthcare delivery as well as managing programs in prevention and disease control. And as, for instance, people that may be working domestically, then they start working internationally, they start to see how they can apply what they're doing here in different settings and with different challenges and solving different problems. So I think in global health, you need both expertises. You need people that know, for instance, you need bioengineers that know how to manage a hospital and all the equipment in a hospital, as well as you need the people that know the preventive part, that know, for instance, how to improve maternal health and know what needs to happen in different parts of the health system to make it work. So I think virtually you can do the same thing, and you need both types of expertises and people that sometimes can do either one.
Right. And what are some of the global health assignments really on both sides of those 2, the systems and the delivery, that are well suited for being done virtually? Are there some kinds of assignments that are better than others, or what kind of work have you seen work well?
I think that's a question that many people wonder, can this be done virtually? Or this can't be done virtually. And I think it's a matter of figuring out how to solve a problem. I think if you can help the client understand what the main issue is, then you can figure out a way to help them succeed, help them solve the problem, sometimes on their own. And for instance, I can tell you that the assignments really vary a lot. And of course, it's very easy to do research and to do a desktop review of all the evidence. And that's very easy to be done online. And but there's also the soft touch of really working with somebody, helping them understand what the main challenges are, helping them see a different perspective and solve the problem from a different point of view. And I can tell you, for instance, some of the assignments I'm working on now. I'm working with a provincial team in one country where I'm helping them prepare for coronavirus. They haven't had the first case, so they're trying to figure out how to be ready at the same time that they're looking at how they can, whatever they do for coronavirus is going to strengthen also the other programs, because they also have malaria, they also have TB, they also have other things, and they don't want other people to suffer because of coronavirus. So helping the team, the provincial team, I'm working with a team of about 30 people to figure out how they can create a strategy that will allow them to really strengthen what they're doing and not undermine what they already have. I'm also working with another professional, helping him write his first book. And so how to come from an idea to actually get the book and I get it published. And sometimes it's a matter of asking the right questions and giving him some tools to make it happen. And sometimes it's just a company through the roadblocks that always come in the middle of any assignment. I'm also preparing for an evaluation of another project, so that means a lot of interviews on phones and Skype. So many things can be done and I think virtually. There are some things that need some more delicate touch that I think ideally you need to be present, but I think you can always figure out a way to make it happen. If you have to do a demonstration of a medical procedure, then probably you would like to show a video, but you would like to accompany people as they do the procedure. So there are some places where it may be difficult to do it virtually.
Yeah, and you mentioned working with the provincial teams, and I've heard of some international consultants that are used to traveling around for assignments that are no longer able to, partnering with a local consultant to be able to continue with their project. Are you seeing this, and any advice for making that kind of collaboration work well?
Yeah, when I first started working in global health many years ago, there weren't people with the capacity and the expertise, but now there's people with several PhDs and master's degrees, and it's a matter of helping them really succeed and identifying that network and building on that. Because I've been working for so many years, I know people in most countries, so I know where to go. But I think it would be great to have a tool, a platform that allowed us to really network in a more efficient way. And it's not just the personal relationship or who's on my LinkedIn network that I can, oh, look, this person I have forgotten. This is good to work with, and I should reach out to him or her. So I think
opportunity for knowledge sharing.
Yeah, there should be a better way of really finding out who's doing what, and then how we can complement each other. Collaboration, it's still on a personal basis, and should be I think networks should be more and more structured and better coordinated.
Yeah, and so you mentioned some of the tools and platforms being important. Are there any that you have found to be particularly useful in carrying out global health consulting virtually?
Email is still great if you use it properly, and it's good to really keep, for instance, track of the decisions that have been made if you had a conference call, and it should be used to really make sure that people are on the same page. And because our inboxes otherwise get so full that it's impossible to stay on track of everything. And so email still works, but you have to use it very carefully. I think it's important to have visual tools that allow you to keep track and see where a project is really moving along, and people can see that the different steps are being accomplished. And I think WhatsApp and Skype are great for one-on-one, and Zoom for larger groups. One tool that I find useful is acuity scheduling, because it helps people see my calendar. So if a client needs to, for instance, one of my clients wants to set up a consulting appointment, they can see my schedule, and that avoids all the back and forth of trying to find the right time. So people go to my website, they click on consultation, and they can see my schedule and pick the time they want to meet. So that I find that very useful.
Yeah.
And there's lots of tools for doing research online. So I think it's perfect timing to work virtually.
Okay. And well, before we came live, we were chatting about the benefits of working from home and being able to wear slippers while you work. In addition to comfortable attire, what are some of the pros and then cons of doing your work virtually?
To me, it's that I think I can start working right away, and I think you can really respond and be more responsive to a client's need in real time. You don't have to wait till they make your travel arrangements and all that. And I think to the client, I think it's very cost effective. They basically, you're just a click away. If they have a problem, they can just contact you right away, and there's no, you save a lot of money on travel, on tickets and per diem, and money that then you can use to implement some of the recommendations that sometimes otherwise they don't get to be implemented. I think the most important advantage is that you can, because you're working through other people that are in country actually doing the work, managing the programs, managing the hospitals, and delivering care, then you get to really empower them, because they get the credit, they get to do the work, and you're just there assisting. You're just there and giving options, or showing different resources, or sharing your own experience, and whining about the mistakes that you made so that you don't repeat them. And so I think it's very empowering, and I think that's why I think this is something that I will probably stay beyond coronavirus and become one way of working in global health. So you really transfer what you know to other people, and they get to do it, and they are the ones that do the work and succeed. I think that that's going to be more sustainable in the long run. And to me, that's the biggest advantage to the client and to the consultant, because you get to see your work. You can really count your success in terms of the number of people that you have helped. So it's really very rewarding.
Yeah, and I guess it kind of evolves your role in being a good coach and trainer, capacity builder, and really empowering local teams to carry out the work.
Right. Mm-hmm. That's right.
So I think you gave some good, compelling reasons why clients should be open to virtual consulting. But any other advice you have for finding these assignments, or convincing prospective or current clients that you are able to be just as effective virtually as you would if you were there in person?
I think now is the time to demonstrate that. And in terms of finding assignments, I think in the same way that you used to network in the old days, you have to network by doing online and having an online presence. And the old saying that out of mind, out of sight, then no, out of sight, out of mind. You really have to also be present online. So for instance, I used to have a newsletter that used to go to about 200 people, no, 2,000, more than 2,000. And, but then less than 10% would open my emails. So then I realized that that's not an efficient way of trying to get my message out and to really network with others. That's why I really like LinkedIn, because through LinkedIn, those that really need or are interested in what you're doing are the ones that are going to read what you're doing. Otherwise, my emails can go to thousands of people and they're not interested, and it doesn't help. I think that you really need to have a good profile on LinkedIn. Sometimes you read people's profiles and they don't even have a picture, or the picture looks horrible. And so make sure that you have a picture that really shows who you are and that people can relate to you. And then make sure that your profile is up to date, that you really showcase what you can do. And as I said, in the two areas, either the health system or the public health area, and really engage, so you can react to other people are saying. And I'm finding so much that is going on, and sometimes you can contribute and add something. You can write articles and posts that really showcase that you can do these things. And you're a good problem solver. You're a person that can use evidence to make decisions and to help others make decisions. And I think if you can show that, you can really show that you can work online or virtually using any platform.
Yeah, really showcasing your thought leadership. And there are so many ways now through social media to do that. And
That's
I
right.
think now with many people at home, you're seeing even more engagement on some of these social channels.
Yeah.
As you say, this is a good opportunity to prove that.
Mhm.
In your post, you gave some advice on how to structure your contracts, particularly if you are doing something virtual. So, any advice there on best practices when it comes to developing your scope of work or how you charge that you think people should be aware of?
Mhm. Yeah, I think usually you have, in terms of how you charge usually by daily rate. Most clients that use that system. Sometimes you can have a lump. I've used that too, a lump sum, and then that depends. Sometimes if you need more time, then it's your problem because you promised that you would do the job for that lump sum. So, and I worked also on retainer, so they can call me anytime and they can send me documents to review or to finish. And so there's different ways depending on the assignment. The important thing is that you really have clarity. Clarity is essential as to what the main problem is that you are to address and who's going to oversee that and when and how. So if you can answer those questions, then your scope of work will be clear. I have a few times I made the mistake of working without a contract, and then by the time the contract came, then the scope of work had evolved. And that scope creep couldn't be uncreeped. And it took more time to figure that out. And also in between, sometimes people change and you're working with one person and the new person thinks that you should be doing something differently. So, and you thought you were solving one problem and now suddenly you have to solve three. So it's important to really be very clear as to what you're supposed to do, who's going to oversee your work. At one time, I was working with somebody, and I thought that person was going to approve my work, and was in agreement with all these things, but in fact, it was his boss that was to approve, and he had a completely different opinion as to how things should be done. So being clear as to really who the client is, and the client is the person that really approves your work and that gives you guidance and says, no, 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 this is not what we want, or this is what we want, and this is the main problem that we want you to solve. And to agree, okay, if I have solved that problem, what will be the evidence that I have solved the problem? So being clear on what the outcome is going to be. Sometimes the outcome is that you want to provide recommendations to improve how a project is doing, how organization is functioning, how a different training program could be developed. And some people think that you, in fact, you should be addressing A, B, C, D, and E. So
So
um,
very clear deliverables
very clear,
and
be very clear in
um,
the deliverables.
yeah. And any advice
Sometimes
for
the language in which those deliverables has to be very clear. Sometimes they write enhance this or promote that. Okay, what does that mean exactly in terms of deliverables? Sorry,
yeah,
go
no,
ahead.
that's good advice. Yeah. So yeah, just thinking about, you mentioned out of sight, out of mind. Same with maybe if you're used to working more in person with somebody. Any advice for how to show your progress or reporting before those deliverables are due, so everyone feels comfortable that the work is moving ahead?
Yeah, throughout the years, I've developed tools like, for instance, I keep a journal. So today I write the date and I just do it on Word and just what I did that day, whom I met, if I conducted meetings, some of my notes and my ideas of how things were evolving. And I find that clients like they don't usually read them, but to get my journal at the end of the week, these are my main points, these are the conclusions, and these are my activities, helps them see where you're going. And I think it's a very good practice to, when you're a researcher. I remember when I was working many, many years ago, I always kept a journal of all the observations and from the anthropological point of view or anything. And I think it's a very good practice to keep a journal and to keep it in a way that people can see that you're moving along. And if you have more objective ways of measuring your work, for instance, you have feedback from other partners. I like always asking people, so what do you think? How can I do better? And I think people appreciate that you are showing you're really vulnerable. You don't know everything, but I can look it up and find out maybe. And I think people relate to that, and they open up. They're more open to consider different points of view, and your help, accept your help in general.
Yeah, I mean, really, when you're working as a consultant, the relationship with the client is really important for that ongoing engagement and opportunities. Well, as COVID-19 starts to impact the lower income countries, and we're all bracing ourselves for some very significant challenges ahead that will undoubtedly require the skills and expertise of the global health community. What kinds of opportunities are you seeing and are you predicting will be out there? What kinds of skills and experts do you think are going to be needed as part of the response? And then particularly those that you think people can contribute to virtually, wherever they may be?
Well, the pandemic is just starting, so basically you have to do everything. We have to design the policies, the strategies. We don't have a cure. We don't have a prevention except social distancing. Vaccine is at least a couple of years down the road. So COVID-19 and maybe 20 or 21 are going to be here for some time. So we really need to start anticipating that and finding ways of working differently. I think that there's a lot of need to really manage big data and to help countries integrate electronic medical records into the surveillance systems. And I think that's the big task that we have to undertake. Now we are mostly using paper in most developing countries, and countries like Nigeria with over 250 million people, it's just impossible to there's so much information that we're losing because we just don't have the systems in place. So I think we have the digital technology to do that. And I think if we really coordinate and collaborate, we can really build the infrastructure to really have effective medical records and electronic medical records, and that really link to the surveillance system and the information system of the country. And then countries can share information and go to WHO, and so that you can see the overall global picture eventually. So
so really working on these systems that undoubtedly are important for responding to COVID, but for any future health crisis,
for all
right?
That's something that's been crippling also the HIV strategy, TB, and so many other programs. So I think we can really solve a whole gamut of problems if we address big health system challenges like that. So good.
Well, you mentioned before that virtual consulting may very well become the norm in a post-COVID environment. So are you seeing that, and do you think that that is the case? And
I think so.
A good thing.
I think it's a good thing, because we'll be forced to work collaboratively and to help other people succeed. And I think we'll have the tools to really expand our influence and to really help those that are in the front lines that really have to benefit from our expertise. And so I think if we cannot risk becoming a vector of coronavirus and bring it into a country. And the same thing, remember in the old days when there was the earthquake in Haiti and people brought cholera. So I think there are very good lessons to be learned and not to repeat. So and at the same time, you don't want to become a victim just because you become in contact. We know that we're all going to be infected eventually, because it's a new virus and we don't have the immunity against it. So the important thing is to keep the curve as flat as we can all possibly do. So it's important that we learn to work in different ways while still advancing the Sustainable Development Goals agenda and keeping in track, because time is running.
Right. Yeah, no, I agree. And I think in many of the conversations I'm having, it's while obviously a really hard time and the impacts are going to be pretty dire for many people around the world, it is an opportunity for us to move much more quickly and really reinventing the way we work that will be more sustainable and more impactful. So hopefully we can all seize this moment.
Absolutely.
So thank you so much for joining us today. Any other advice that you have for our listeners out there who are consulting or considering?
Yeah, thank you. I think it's please keep doing this. I think it's wonderful to help all the global health professionals that are working from their home offices to get connected. So I would really like to encourage those that are listening to really, if you haven't worked virtually, to really give it a thought and to really look at ways they can develop that expertise. And there's the articles that you mentioned, and also I wrote another article on how you can virtualize your programs. If you're already working in global health, how you can really change how you're working to do it virtually. And I also created a LinkedIn group on virtual consulting. So I would like to invite everybody to join that and share ideas. I think there's so much work in global health that there's a lot for everybody. And if we work together and we work collaboratively, I think we can really put an end to coronavirus and all the other diseases that have been affecting mankind. When I started as a physician, we were still fighting malaria and tuberculosis, and then HIV/AIDS came, and we're still doing that. So I think we have to find ways of working more effectively and really get tangible outcomes. So thank you so much for inviting me.
Yeah, great. Thank you so much. I appreciate all the tips and advice, and we'll continue to be exploring how everyone, wherever they are in this global workplace, can pivot and still continue to do the good work that they need to do wherever they may be. So thank you, Elvira, for joining us today.
Stay safe.
Right.
Bye-bye.
You too. Thank you. Take care.